This data is in reaction to the U.S. Preventative Services Task Force recommendation from November of 2009, where they suggested that mammograms should not be done routinely for women 75 and older. Part of one of their stipulations was that older women are more likely to have indolent, less aggressive breast cancers. So in our cohort, as well as in other cohorts, we've seen, and in our cohort, up to 69% of the women of the older women, 75 and older, had moderately or poorly differentiated cancers, and those cancers are more aggressive, suggesting that they may benefit from treatment. So we can't treat them unless we diagnose or find the cancers, and the best way to find the cancers is through screening. The other concern about the U.S. Preventative Services Task Force is that there's no randomized controlled trial data for the older women. So randomized controlled trials have not been done, and so they're making recommendations not based on the data showing no benefit, but the lack of data. So we, together with other cohort studies, have shown a benefit of screening within a more timely interval. And so we're showing that women that were screened either 2 to 5 years or more than 5 years or not screened at all had a greater risk of dying from breast cancer for the cohort overall, and then especially for the older women.
Well, how does this translate into, say, a primary care recommendation? Are you talking just about that, what we hear all the time, individualized medicine, taking someone's own risk factors and just trying to make the equation work for them?
Well, I think that translates. I think it says, it indicates that the conversation about mammography should continue for older women. And of course, you have to take a woman's desire about what she wants to do. It's all individual, what the person wants to do, and looking at comorbidity. Now, we adjusted for comorbidity and took that into account, but we have to look at competing causes of death. And certainly if there's a lot else going on, and if somebody's being treated for significant other medical problems, then we're not as worried about screening as we are in treating perhaps their heart disease or their other causes, comorbidity. So, but I think for the women and for the primary care physicians, for perhaps oncologists and surgeons, is to consider mammography for older women and not just to outright say no.